How's it going?
It's going all right.
It's very nice to meet you. My name is Dr. Perez.
Okay,
You can call me Sarah if you're more comfortable with that.
All right.
I am an endocrinologist, which in less convoluted terms essentially means I'm a diabetic specialist.
Okay.
So I was sent a referral by your primary care doctor. They want me to go over a couple things with you today and do a bit of a consultation.
That's correct.
Okay. So give me just a second here. I need to get logged into the system, and then I'm going to go over a couple notes given to me by your doctor so I can make sure that we're not missing anything today. So I am just going to get logged into your chart here. I will be dictating just a little bit on my keyboard as we go about a couple portions of this examination.
Okay.
Are you feeling generally well?
I am feeling generally well, yes.
Good. Okay. Just to get started, of course, can I have you confirm your first and last name for me?
Sure. James Monroe.
Okay, and how old are you?
30 years old.
Perfect. Okay. And to the best of your knowledge, you're here for a diabetic consultation, essentially.
Yes.
Okay. Thank you very much for that. Just going over what I have from your doctor. So it looks like we're going to be doing a couple screenings for a few syndromes kind of secondary to your semi-uncontrolled type 1 diabetes. Is that correct?
Yes, it is.
Okay. And just for the purposes of your chart today, I do have that we have your therapy cat at bedside, and this is baby cat, correct?
Yes, it's a baby cat.
Okay, perfect. Thank you very much for confirming all of that for me. Okay, so let's go ahead and dive right in. I want to start with a few preliminary questions, just kind of pertaining to your overall health. So don't think too hardly about anything.
Okay.
They're not super in-depth, just answer to the best of your ability. We'll kind of rapid fire through this first part, okay?
Sure.
Alrighty, so at what age were you first diagnosed with diabetes?
15 years old.
15, okay. Perfect. And do you check your blood glucose on a daily basis?
I do, for the most part.
Okay. Perfect. Do you remember what it was this morning by chance?
Yes, it was 147.
147, okay. So 147 is slightly elevated. So I do want to just go over a few pieces of information with you. This is likely stuff that you're already pretty familiar with, but it is important to provide you with the information as well as treat the physical symptoms, okay? Okay, so are you okay with me going over a few educational pieces with you today?
Sure, that's fine.
Okay. All right, so let's go ahead and get started. Okay, so as a diabetic specialist, my job is to assess your body, mainly your pancreas's ability to produce insulin. And we do this a couple of ways. So in order to assess how well you're producing this insulin, we can either perform a capillary blood glucose test, also known as a finger stick, which is likely what you do at home to check your blood sugar. We can also do this by testing your A1C, which is done by obtaining your labs or a blood test in order to see how much glucose is in your bloodstream. So essentially testing how much sugar is in your body. Okay, so those are the two ways that we kind of go about obtaining that information.
Okay.
So these are both tested on a scale. When we check your blood sugar, we'd like it to be anywhere from the 70 to 100 range. So as I stated, your blood sugar this morning was slightly higher than what I would like to see. If we were checking your A1C today, it would be somewhere under 5.7 is what we would like to see. So you're probably a little bit higher than that, given that you're slightly uncontrolled, and that's something that we will test at a later date, okay? So that kind of gives us a little bit more of a good indication what it could be, because your blood sugar will fluctuate depending on what you ate, how long ago you ate before you took it, and that kind of thing, whether or not you were fasting. So it does make a big difference there, okay?
All right.
Okay, so glad to be able to provide you with that information. So let's go ahead and move on to some applied knowledge. Are you okay with me testing your blood glucose today?
Yes, I'm fine with that.
Okay, perfect. So allow me to just bring my cart over. I have a little station here that I'll be using. It's got some tools on it.
Okay.
So I'm just gonna go ahead and place a pair of gloves on, and I will be just getting a capillary test on you today. So do you have a preference which finger I check it on?
No, I don't.
Okay. These gloves are a little big for me. I apologize. Okay, so can I have a look at your hand to start? If you'll flip over for me. So typically like to test either the index or ring finger. I'm sure they educated you at home. We try not to test on the thumb or the pinky just because you have some arteries there that we don't want to risk damaging. So your index finger is looking good. You do have slightly thicker skin, so I'll just keep that in mind. So I'm just going to use an alcohol swab. Okay, and while that's drying, I'll go ahead and get everything ready. So this is just our testing meter. It's probably similar to the device you use at home. As well as our test strips. So give me just a second to adjust. Perfect. Okay. It's going to be a slight pinch, slightly uncomfortable, okay?
Yes.
1, 2, 3. Very good. Remember, when you test at home, it is very important to waste the first drop of blood, and then after it's dried, you go ahead and extract a little bit more. Okay, that'll take just a second. And then, of course, apply pressure for just a few seconds there. So your current blood sugar is 118, so it has gone down since this morning. How long ago did you eat?
It's been a while. 6 hours.
Okay, 6 hours. So it should be slightly lower given that you haven't eaten in the last 2 hours.
Okay.
So that does once again confirm that you are slightly uncontrolled there, okay? So something to note for sure. Let me go ahead and put this away. Just move that out of the way for a second. Okay, so let me just notate that. So your blood sugar was 118 and your last meal was approximately 6 hours ago. Have you had anything to drink since then?
Yes, I have.
Anything with sugar in it?
Yes.
What was it?
Apple juice, actually.
Apple juice. Approximately how long ago was that?
45 minutes ago.
Okay, so that could explain the spike as well. So typically after 15 to 20 minutes of eating, you will see a slight spike in your blood sugar. So that could be the reason for that, but it does give me a good indication here. Okay, so let's move on to the screening portion of your examination today. And I will be testing about 3 to 4 things for you, okay?
Okay.
So the first thing we'll be testing is called diabetic retinopathy, which I'll go over all of these before we start the examinations. The next thing I'll be testing is called xerostomia, and then I will also be testing you for chiroarthropathy, also known as diabetic hand syndrome. So I know that's kind of a mouthful. Like I said, we'll go over all of them individually before we get started with the testing, okay?
Sure.
Okay. Okay, so jumping right into your diabetic eye exam, I do want to give you just a little bit of a warning. It is slightly invasive, so I will have you remove your glasses. I'll assess your eyes. At times I will be touching your eyes and needing to get very close to your face. So I apologize for that. I will be invading your space just a little bit, okay?
Sure.
Okay, so several things we'll be testing. Part 1 of this screening will involve a couple of questions, and part 2 will be the physical examination, okay?
All right.
Okay. So obviously at any point if you feel uncomfortable, just let me know.
Okay.
So getting started with part 1 of the assessment, can you tell me if you've experienced any recent changes in your vision? Recent being 6 to 12 months.
I have actually. I feel like my vision has deteriorated in that time period.
Okay.
The last 6 months or so. I don't see as well as I used to.
Okay, so I'm not seeing as well. And pertaining to objects physically or like reading or just everything in general?
Reading, mostly on my phone, a little bit while driving as well.
Okay. All right, and has your prescription changed since your last eye exam with your optometrist?
No, they said there was no change.
No changes. Okay. And how long ago was that visit?
It's coming up on a year.
Okay. And prior to that examination, how long had it been?
3 to 4 years.
Okay. So you were overdue, but when you went in, there were no changes.
They
But
said it was
since
fine.
then, you feel like you have experienced some changes.
Absolutely.
Okay. So these changes are obviously very noticeable to you. Is it something gradual that you feel like has happened, or is it something that's happened like pretty
I
rapidly?
feel like I kind of just noticed it one day. I don't think it was gradual.
Okay.
That I was like straining to see
Okay.
more than I was before.
Okay. So are you seeing any shapes or floaters in your vision? Any like lights that aren't there?
I do see floaters. At
You
times.
do?
Yeah.
Okay. How frequently would you say that is? Like on a daily basis?
Yeah.
Okay. Any blurred vision or partial vision, like where you feel like you're seeing out of one part of your eye, but maybe not seeing everything?
Not necessarily.
Not so much?
Maybe if things are too close, sometimes it might look a little blurred.
Okay.
I have to back it up a little bit, but not when I'm just focusing on something.
Okay. How about any eye pain or eye redness? Abnormal eye pain or irritation?
I do get eye pain if I'm on the computer for too long. I do work from home. I spend a lot of hours on the computer, a lot of hours on my phone. And sometimes I relax to watch TV, and that's probably not the best thing to do. So like late at night, I gotta take a shower. If I look in the mirror, my eyes are red.
Okay.
Yeah.
Do you use any drops or anything to subside the redness?
I don't know.
You don't. Okay. Any dryness associated with that?
Sometimes, yes.
Sometimes. Okay. Do you have any difficulty seeing in the dark?
I don't think so.
No.
Once my eyes adjust, I don't think so.
Okay. So it takes you just a couple minutes to adjust to dark, as does with everyone else. So
Yeah.
that's okay.
It's okay.
Hi, baby cat. I bet you don't have any difficulty seeing in the dark. Okay, so let's go ahead and move on to part 2, which will be the physical portion of the examination. And I will be needing to dilate your eyes today, which I know is not something anyone really looks forward to, so I do apologize for that.
Okay.
I did note that you needed to bring someone to drive you home,
Yes.
so you have someone in the waiting room?
Yes.
Perfect, okay.
Baby cat doesn't have her license.
Baby cat is not a safe driver, unfortunately.
Just a permit.
Okay.
A permit.
Dad jokes. Alrighty, so as soon as I get this open, it is a little bit difficult. Child safety lock. Oh my goodness. There we go. Okay. All right, so these are just some eye drops that are going to dilate your eyes. It is very, very cold. These are kept in the fridge. So I do apologize for that. It is going to be slightly uncomfortable, okay? So I'd like you to tilt your head back for me. Perfect. I apologize. I will give you a tissue. Head back for me. Okay. So go ahead and sit for a second. Let me grab you a tissue. There you go. I'll give you just a second. Okay, so that does take just a little bit to kick in before your eyes are fully dilated.
Okay.
In the meantime, I'm going to just perform a couple palpations of your face. So that'll just consist of me using my hands, touching around your eyes, just kind of getting a feel for things, okay?
Sure.
So you're welcome to close your eyes or keep them open, whatever makes you more comfortable.
Okay.
Okay, so just having a look, looking for any notable swelling of the face around the orbital socket. And also looking for any signs of asymmetry around the eyes, making sure that there's not any drifting or any signs of atrophy in the very small muscles that control your eyes, which so far I'm not seeing. As I palpate here, is this uncomfortable for you at all? Do you feel any pain or pressure in this area?
No, I don't feel any pain.
Okay, as well on this side.
No pain.
Now about up here along the sinus cavity, nothing here.
Not really, just a little bit right there, but I think that's just a slight headache that I have.
Okay. Do you have seasonal allergies typically?
I do, yeah.
Okay. So usually if we have pain or pressure in the eyes that are kind of midline to the eyebrow, that's usually seasonal allergy related. As I go just gently above the eyes here, any pain or pressure in this area?
No.
And on this side as well?
No, no pain, no pressure.
I could have you open and look all the way up for me. Any discomfort here?
No.
Okay, you can go ahead and relax your eyes. Good. Can you open your mouth for me? Okay, you can relax. Thank you very much. Okay, just going to take a quick note on my keyboard here.
Okay.
Okay, so now that your eyes are slightly dilated, I'm going to go ahead and move on. And at this time, I would like to test cranial nerve 3, which is your ocular motor nerve. So basically what that means is I will be using a light to test your pupillary reaction to start. So kind of shining this in and out of your vision as well as occluding one eye at a time, looking for proper constriction and dilation as well as symmetry and reaction between the eyes, okay?
Yes.
So obviously your eyes are now dilated. They're going to be very sensitive to the light, so you might want to keep your tissue nearby, okay? All right. Okay, so getting started, I'll have you just look straight ahead for me. And if at any point it does become painful, just let me know and we can give your eyes a little bit of a break, okay?
Sure.
So I'm going to start by bringing this into your field of vision. Okay. You're doing very well. So I'm going to perform what's called a swinging light test, and I'm just going to swing my light back and forth like a pendulum, looking for a very specific reaction here.
All right.
Okay, can I have you look up for me? And look to the left. A little bit of redness here, and look to the right. The inner corners of your eye are slightly red. I'm going to have you look down, and I'm going to hold your eyelid so that I can see. Okay. give you just a little bit of a break there. I'm sorry.
It's okay.
Okay, so I'm going to do that one more time very quickly. This time I'm going to use a card to kind of block the vision on one side.
Okay.
So checking for your direct and consensual response here. Perfect, you did very well with that. Great job. So give me just a second here. Okay. All right, James, so the next thing I'm going to do is test your corneal reflex. I'm not sure if you've ever had this examination performed before. Essentially, as kind of the body's safety mechanism, when something comes towards your eyes should close. So I will just be testing that reflex today. It can be a little bit uncomfortable. Nobody likes things kind of poking at their eyes, so I do apologize there, but it is an important part of our testing today, okay? So I'd like you to open your eyes kind of lazily. If you need to blink, you can. Don't fight the response, just kind of let your body react as it would, okay?
All right.
So first, just bringing something kind of very close to your eye. Now I'm going to actually touch your eyelashes. Good. Good. So you'll notice that natural reaction to want to close your eye. Good job. Okay. Now I'm going to do that with a puff of air. Okay, so I'm getting a stronger reaction on the left side. Are you right-handed?
Yes.
Okay. Good. Okay. All right, so I'm going to do that again, this time tapping on your face. So again, I'm just looking for the natural reaction in your face here, okay? So just I'm seeing a little bit of a muscular reaction there. Can you feel that?
Yes, I can.
Okay. Okay. Almost done with this part of the test, James, okay? Good, okay. You did very well with that, so no need to worry. So I'm just going to catch up on a couple of notes here. So your corneal reflex test was well within normal limits. Okay. All right, James, so I'm going to move on to cranial nerve 6, so testing your abducens. And in order to do this, I'm going to have you first follow an object with just your eyes, not moving your head, and then I'll have you do the same thing following a light, not moving your head, okay?
Sure.
So I'd like you to look at this object here. Can you tell me what color that is?
Blue.
Perfect. So I want you to follow it with your eyes only. Try to keep your head midline if you can, okay?
Sure.
Very well, so keep your head here for me. Perfect, follow it in and out. And does that get blurry as I bring it in?
Yes, right about there.
About here. Okay. Right, so doing the same thing again, I'd like you to follow the light. So can you see the light here?
Yes, I can.
Perfect. Follow with your eyes only. Is there any point here where you cannot see the light?
No.
Good. Follow it in. Perfect. Very good. Okay, so no issues with cranial nerve 6. You did very well there. Okay, so we are almost done with your eye exam. The last thing I'm going to do is take some pictures of your eyes. And to do that, I'm going to be using this device, which is called an ophthalmoscope. You might have seen this with your regular optometrist. I'm going to be using it in a little bit of a different way today. So I'm going to be taking some photographs that are called stereoscopic fundus photographs. So essentially taking pictures of your eye, okay? All right, so what I'm going to do is get fairly close to you, and I'd like you to turn your head for me first to the left. If it's all right with you, I'll have you move your hand for just a second. Perfect. Okay, so open wide for me. Good. I'll have you look at me. You can turn your head straight. Perfect. Eyes wide. And look to the right. Good. Okay. So same thing with this eye. I'll have you turn to the right first. Okay, and look at me, head straight, open wide. Perfect, and look to the left, head straight. Good. Perfect, okay. So several photographs taken there. Okay. Okay, so perfect. I will save these and analyze them at a later date, and I will go over that with your doctor, and they'll kind of give you the results of those pictures, okay?
Sure.
All right. Perfect. So moving on, are you feeling okay to continue?
Yes, I am.
Okay, great. All right, James, so now we are going to screen for xerostomia, or excess mouth dryness, secondary to uncontrolled diabetes. So I know that seems like it could be unrelated, but this is part of the screening today. So what I'm going to do is perform a test of cranial nerve 9, which is your hypoglossal nerve. And in order to do that, I'll be performing a swallow screening.
Okay.
So what I'd like you to do is keep your head in the position that it is for now. I'm going to put my hands on either side of your throat, and I would like you to take a deep swallow. Good. Now tilt your head back. Same thing. To the left. Same thing. And to the right one more time. Are you feeling that your throat is rather dry?
It's very dry, yes.
Okay. I can have you open and say ah. Okay. So it does look a little bit abnormally dry to me, and I think what I would like to do is try to induce a salivary reaction. So I have Just some regular salt water. It is sterile saline, so there's no need to worry. Okay, and essentially this is just going to produce a salivary reaction. So anything acidic or salty should make your mouth water.
Okay.
If it doesn't, then there is a slight cause for concern there, okay? So doesn't taste very good, I do apologize. Just kind of move that around in your mouth for me. Do you feel like it's helping?
A little bit, yes.
Mouth's kind of salivating a little bit?
Yes.
Okay, so your salivary glands are behind your tongue or kind of underneath, and they should be moving a little bit better. Okay. So if I can have you turn to the left, swallow one more time. Much better. Okay, very good. Good job. Sorry that is uncomfortable.
It's okay.
So moving on to testing cranial nerve 12, which is your hypoglossal nerve or your tongue's ability to move, I would just like you to perform a couple of the following things, okay? So if you can stick your tongue out for me, and to the left, to the right, and up, and down. Good. No issues with that. So I'm gonna have you put your tongue on the inside of your cheek. Good. And behind your lips if you can without opening your mouth. And then kind of down, perfect. And up towards the roof of your mouth. Good. Okay, so no issues there as well. You did very good. All right. Doing well. We are moving right along. So one final screening to perform today. And again, part one will consist of a few questions, okay? So I'm just going to have a seat here for just a second. Okay, so proceeding with a test of chiroarthropathy, which is a mouthful. Essentially, that means I'm testing you for diabetic hand syndrome, which consists of a couple different things. So the syndrome itself is kind of a cumulative score. So you have to hit certain markers to qualify for the syndrome as a whole, okay? Okay, James, so diabetic hand syndrome affects about 30% of people with uncontrolled type 1 or type 2 diabetes. And this test will also test for LJM or limited joint mobility of your fingers and your hands, okay? All right, so we are going to go ahead and get started, and I do just have a few questions as I stated. So if you could please just answer the following questions to the best of your ability. Are you currently or have you previously experienced any numbness or tingling in your fingers or hands?
I don't think so, no.
Okay. And any burning, aching, or cramping sensations in your fingers or hands? Good. And have you ever noticed that you tend to drop things frequently or like a loss of grip strength? Do your hands tend to be fairly clumsy where you maybe you're holding on to something and then you suddenly lose your grip and let go of it?
No, I don't.
No. Okay. Very good. And no noticeable loss of strength overall in your upper extremities. So you feel like you still have the same willpower in your hands that you did before.
Yes, I do.
Okay, perfect. All right. Okay, so as the final part of your examination, I will be just having a look at your hands. Is that okay with you?
Sure.
Okay, so I think what I'm going to have you do is sit in a chair for me. I will adjust the table. We'll place your hands on the table just so I can get a more of a hands-on look here, okay?
Sure.
All right, so let's get that set up and then we'll continue.
All right.
All right, James, are you ready to get started with your hand exam?
Yes, I am.
Perfect. Okay, so I'm going to go ahead and start with just an overall look of your hands, and this will be very brief, just looking for any signs of kind of acute abnormalities, looking for any signs of swelling, swelling of the joints, swelling of the fingers, looking at the nail bed, as well as the cuticle, looking for any signs of excess dryness or splitting of the skin. So diabetic patients do tend to have drier skin, so that's something that we have a look at here. Can I have you flip your hands over for me? Good. Okay. So nothing on an external level appears to be abnormal, which is a good start. So I'm going to start with some palpations. We'll do one hand at a time. I'll let you decide.
Sure.
Okay. So just going to palpate around your joints. So palpating the wrist as well as the joints in your fingers. Of course, let me know at any point if this is painful or uncomfortable for you. Okay. Just assessing the overall skin texture. As well as checking for any temperature abnormalities, which the back of your hand is a lot cooler than your fingertips. Your fingertips are very warm, which is a good indication that there's healthy blood flow. So I'd like you to just relax your fingers for me and just allow me to kind of manipulate your joints individually. Testing for normal flexibility, making sure nothing is overly rigid. Okay, so flip your hand for me. Perfect. Look at the color of the palm and overall evenness of skin texture and skin tone. Looking for any signs of abnormal darkening of certain areas, which I'm not noting here. Skin is very smooth, not overly dry. It does appear well moisturized. You do have fairly large hands. Maybe flip over for me one more time. So just going to assess your capillary refill, which essentially means I'm occluding blood flow to your finger and then allowing it to return. Just checking for how many seconds that takes, and I'm getting healthy +2 response here. Perfect. Okay, so let's go ahead and switch hands. Again, just having a look at the overall condition of the skin. I do notice a slight patch of discoloration here. Have you always had that?
Yes, it's a burn.
Is it? Okay.
Yes.
It's fine. Again, just assessing the individual bones of your hand. Skin texture is very smooth and even throughout. You do have a very small mole there. Once again, testing capillary refill. And this discoloration here, is that new?
I don't think so.
Okay. Okay. So I'll have you place both hands on the table for me. A scar here, but it does appear to heal fairly well. Okay, all right, very good. So let's go ahead and move on. And at this point, I think I would like to perform a strength test. So what I'm going to do is I have a tongue depressor here, and essentially just made of wood. It's slightly pliable. As you can tell, it bends and flexes. I want you to hold it in your hands just like this and attempt to snap it in half. You're welcome to actually break it.
Are you sure?
Mm-hmm. Facing down towards the table. There you go.
And just snap it?
Just snap it in half. Very good. Good job. So obviously no difficulty with that. So just testing your hand strength. You did very well there. And the next thing I'm going to do is test your ability to feel certain objects with your hands closed. So if I could have you close your eyes, I'm going to ask you to perform a couple of tests and no peeking.
Sure.
So keep your eyes closed for me. I'm going to place 5 objects on the table. I would like you to attempt to pick out the 2 wooden objects. So I will guide your hands. There are 5 objects here. If you can, pick out the 2 wooden objects.
These 2.
Perfect, very good job. So keep your eyes closed for me. So again, of the 5 objects, if you could pick out the 2 metal objects.
This one for sure. These 2.
Very good. So keeping those 2 objects in your hands, can you tell me what the difference is between the 2 of them? You're welcome to manipulate them in whatever way.
This one's thin, this one's thicker.
Good.
This has a rounded edge, this has a pointed edge.
Okay. So there's one more distinct difference. If I kind of guide your hands
One is longer than the other.
Down, push down.
This one moves, this
Very
one
good.
doesn't.
Okay, good job. Okay, so you did well with that. You are welcome to open your eyes. No difficulties or abnormalities with that test. You did fairly well. So the next thing I'm going to do is just very briefly assess the size of your thumbs. So if you could just stick, very good, perfect. So just like that, I'm just going to doing very well. Okay, good. fairly similar there. Okay, so the next thing I'm going to do is hold on to this object, and I'd like you to try to take it away from me.
Okay.
Good. Now I want you to do that with your other hand. Good. Now I want you to hold it just like this. And don't let me take it away from you. Good. And in your other hand. Very good. Okay, go ahead and let go. So if I could have you squeeze my hands. Squeeze, squeeze hard. Harder, harder. Very good. Okay. That's okay. Thank you. So if I can have you hold your thumb and your index finger here. Now don't let me pull them apart. Good. Can you do your thumb and your pinky? Good. So hold your hands up just like this. Fingers spread apart. Don't let me bring them together, okay? Now, if you can pinch them together, don't let me pull them apart. Good. Now, hands up just like this. I'm going to push back. Don't allow me to push back, okay? Good. Now, towards me. Very good. Okay. So if you'll turn towards you, I'm going to push in. Don't allow me to do so. And now push towards me. Very good. Same things with your upper arm. So if you could bend at the elbow, don't allow me to pull, and now don't allow me to push. Very good. Okay, so upper body strength appears to be within normal limits. Not seeing any cause for concern there. Circulation also appears to be well within normal limits. Your fingertips are warm to the touch. I didn't notice any decrease in your circulation of your fingertips or return of blood flow there. Not noting any signs of inflammation of the joints. So give me just a second while I take a few notes here. Joint health appears to be within normal limits. And capillary refill was +2. Graphesthesia was negative. All right, James, so the last test I'm going to perform on your hands today is something a little difficult. So I'm going to use this tool to draw a letter or number in your hand, and I'd like you to try to guess what that is, okay? And it is a capital letter. Okay.
S. C.
Good.
A.
Very good.
P.
One more time. P.
P.
Okay.
So it's not P.
It's not P.
One more time, please. I'm really not sure. B.
Okay. So that was a capital D.
Okay.
Very close to capital P.
Okay. T.
Good.
Y. X.
Good.
One more time. Y.
Very good. Okay. Same thing on this side.
P.
I apologize, these are numbers. That was my mistake, so I'll try that again.
All right. 9.
Good.
One more time, please. I still didn't catch it. 8.
Good.
7.
Perfect.
One more time. 6.
Okay. You did very well. That was a 6. I am going to try that just one more time. Let's try this tool. So close your eyes for me.
Okay.
Again, this will be a number.
5.
Perfect.
7. Oh, I didn't catch that one. 4.
Okay. And one more time on the other hand, and this will be a letter.
Okay. W. Or N.
Okay.
Z.
Z. Good job. Okay. So I think part of that was the tool itself maybe wasn't quite sharp enough. You do have fairly thick skin on your hand, so you weren't quite feeling it, but you were able to get the alternate choices. So obviously a capital Z and a capital N, depending on what direction they're facing, they are the same letter. So you did very well, and I will consider that a passing score. Okay? Perfect. Okay. All right, James, so that concludes our screening today, and we did go over quite a few things, so I appreciate your time. I will be going over everything and will update your primary care physician with my findings, likely tomorrow or the following day. So please reach out to your primary care physician if you haven't heard anything by about Monday morning, okay?
Absolutely.
Okay, so I do have a couple more things that I'm going to put into the computer here, so you are welcome to take your time as needed, and I hope you have a good evening.
All right, thank you so much.
Thank you so much. Have a good day.
You too.